Good morning, everybody. Thank you for joining us for our press briefing today on a very important program that we're going to be rolling out here on July 16th. It's going to be the National Suicide Hotline with the 988 phone number. So we'll talk a little bit about that in more detail, but let's just start off talking about how suicide is a national public health issue. It is the 10th leading cause of death in the United States. Now, here in Nebraska, we have worked to be able to improve our mental health services for the citizens of our state. So I've got here with me today Sherry Dawson, who is the director of our Department of Behavioral Health and the Department of Health and Human Services. And then also Kyle Kinney, who is the program manager at Boys Town for the Lifeline services. And at the state of Nebraska in our behavioral health, we rolled out, actually years ago, our system of care to be able to really target youth and parents who are experiencing behavioral health, mental health issues. And that program has been very successful. We've had over 1,800 youth be referred to that program, and we've been able to successfully help 75% of those folks without inpatient care. So the goal is to really get to those families, get them resources, so that we can keep kids in school and with their families. And we've been very successful along those lines. So that's one of the things we've done to be able to help address those issues. The Department of Health and Human Services has also been very involved with a number of different programs to try and help people with suicide prevention. So for example, we've helped train over 30,000 people in QPR, that's question, persuade, refer, that's adults and youth, with regard to suicide prevention. In our schools, we have the Cognito program, and over 40,000 educators have been trained in that. And in addition, the Department of Health and Human Services has worked with the Department of Education on our behavioral health school resource guide to be able to provide that to all the schools that we have here in our state. And we've also trained 943 folks specifically in mental health first aid to be able to help with this as well. So we've seen a lot of efforts on the part of the state to be able to help with these resources. And in fact, we're continuing to make those investments. With the legislation that was passed in this previous legislative session on the American Rescue Plan Act, or ARPA, we passed $60 million, for example, for UNK to do health training and so forth, create a facility there. $40 million specifically, an additional $40 million specifically directed at behavioral health facilities to be able to expand the capacity there. And then another $5 million directed toward things such as loan repayment for people who want to pursue a career in nursing or behavioral health. So we continue to make those investments here in our state with regard to that. And then, of course, on June 6th, we just announced our Governor's Challenge to help prevent suicide among our veterans. So we continue to put a focus there as well. And what we see is with our efforts here in Nebraska that we get ranked very highly. Mental Health USA ranks us the fourth best state, U.S. News and World Report ranks us the fourth best state for mental health. And we actually have the lowest suicide rate among any of the surrounding states. So we've been successful here. One of the things that has helped us be successful is that we have our National Suicide Lifeline, and that's the 1-800-273-TALK number we've mentioned a number of times in the past. Well, one of the things that is really exciting is back in 2020, the Trump administration passed a bill to create a National Suicide Hotline that would be like 911. So we called 911 in case of an emergency. You need the police to show up, you need an ambulance, something like that. Well, now we are going to have a similar number for suicide prevention, 988. So if you are experiencing some of the symptoms of suicide or behavioral health issues, you can call that 988 number, and we'll be transitioning from the 1-800-273-TALK to this 988. But I think it's also important to note, if you've got ideas of suicide ideation, you can call this number and talk to somebody. And it will go to Boys Town, somebody here in Nebraska. Almost all the calls will come in here into Boys Town. And Boys Town has a lot of experience with this. They started providing hotline services back in 1989, and there's Lifeline service back in 2005. So they've been doing this for a long time, and they're very good at it. I think it's also important to note that if you're a loved one or a friend of somebody who you are concerned about, you can also call this number to be able to help get resources. And this is one of the things I think we can all participate in helping our neighbors by looking for those signs of suicide, right? Start looking for that person who maybe feels hopeless about the future, or who's depressed, or who's isolating themselves. Maybe they don't have proper sleep habits anymore. Maybe they are getting angry unreasonably about things that they wouldn't ordinarily get angry about. Maybe they've got hypervigilance about things, right? All these are symptoms that someone may be experiencing behavioral health, mental health issues, or may be susceptible to suicide ideation. So that's an opportunity for those friends and family members to call this line as well, 988, to be able to say, hey, I need some help. So this is really a tremendous program that we're rolling out here today that should help us have another way to be able to reach out to people and provide those services and provide that help. So I'm very excited about being able to do that here today. And so I'm going to turn it over to Sherry and Kyle to talk a little bit more in depth, and then we're going to come back and we've got a video we're going to show about this as well. So with that, Sherry, I'm going to turn it over to you.
Thank you, Governor. I really appreciate Governor Ricketts. When I talk to my peers in other states, the frequency of which I have the opportunity through the governor to share behavioral health projects and initiatives is really uncomparable. So I very much appreciate the continued championship and really do want to ground us in this 988 project. And what it really does is provide the opportunity for hope and connection, someone to call, and ultimately save lives of Nebraskans. And so I want to share an email I received from a person, a family, that accessed the 1-800-273 talk line. It says, as a parent, I never want to have to ask for help. As a parent, I do not want my children to struggle with depression, drug addiction, suicidal ideation. But when these struggles become a reality, in our home, the Suicide Lifeline saved my son's life. Through calling the Lifeline, he was able to connect with someone who listened without judgment, was empathic, and was able to provide immediate referrals to life-saving resources. The Lifeline provided the help and the healing resources that we as a family need to support my son as he begins his journey of recovery. And that was signed Jack. And so that really grounds us today in the opportunity before us. So I want to thank the hundreds and probably thousands of Nebraskans that have been a part of the implementation planning for 988. And I want to also level set that we have been lucky in Nebraska that Boys Town has provided the 1-800-273 talk line. And so this July 16th date is really about making that dialing easier. So we're switching from nationally the 1-800-273 talk to the 3-digit dialing of 988. And as you can imagine, in Nebraska, we have such wonderful partners. And I want to thank, we have some of our core implementation work group here, and I want to recognize them. Michelle Nunabaker is from the Division of Behavioral Health, and she has been our chief 988 planner. She actually walked in to join us, and a staff member transitioned to another division, and she's just jumped in and has been just such a wonderful leader. We have the University of Nebraska Public Policy Center. We have Ashley Miller here today, Dr. Denise Bowling as key partners. They're also going to be doing evaluation, so we have a neutral look at how we're doing as a system. Corinne Meadows from the Nebraska Alliance for Mentally Ill is also with us. Brad Negretti, I always want to put an E on there, from Lutheran Family Services. And am I missing anybody? Okay, there's other members, Kyle, of course, of our team, but we just couldn't have done it without them. And we also have amazing behavioral health partners. We have been lucky in Nebraska to have mobile crisis response teams, as the governor mentioned, for some years. We've had adults, and more recently, youth across the state. Those folks work tirelessly 24/7. They have crisis lines and get activated to actually serve people in their homes or by telehealth and do assessment. And again, they are saving lives. We have so many behavioral health partners, our regions, our emergency system partners, all of our providers, and our stakeholders that have really helped get us to this moment of Saturday, July 16th. The Lifeline for 988, the purpose really is to have it be easy to remember so that when folks are in crisis, they didn't have 1-800-273-TALK programmed. It will be easier to dial. And it also elevates us to, as we think about this system in healthcare, that we have the opportunity for the medical side for 911 to begin to have a service system that is similar so that we can serve people earlier and ultimately save lives. I want you to know that it's always hard to have conversations, but as the governor said, it is critical that each Nebraskan be a champion. One of the most common things I hear is that when somebody has a behavioral health question or crisis or maybe has been in the hospital, people don't say they don't know what to say. And so I would just ask you as champions, if someone was coming out of the hospital for surgery, you would have a conversation about how are you doing? Is there anything I can do to support you? And it is no different for individuals that experience behavioral health. And it's never too early to have those conversations, again, from a prevention standpoint. So we're excited about this opportunity to roll out. We do have a toolkit that will be posted on our DHHS Division of Behavioral Health webpage that will have some items, social media, some posters, frequently asked questions, so that all Nebraskans will have an opportunity to continue to share the message. And we'll be having some webinars, which we'll also post through social media to continue to help individuals know about this rollout and answer questions. So ultimately, the system that we want to design has three components. Someone to call, which is now going to be 988, and we also have our crisis service numbers in Nebraska. Someone to respond, which is our mobile crisis response teams, which we have all across the state. And then somewhere to be referred or somewhere to go. And we have great services across Nebraska, but the somewhere to go is still an opportunity for us to continue to grow services, easier and earlier access. And there are a number of partners planning some development, so over the next couple years, I'm really excited. But one of the opportunities we have in Nebraska for someone to be referred is that we have many providers that do same-day or open access, where somebody could be referred, and there's a block of time where people can go, and they can be served and assessed by the provider. And sometimes it could be about, maybe thinking about medication. And so we will continue to work with our insurance partners and our Medicaid partners to make sure that we all continue to grow those resources. So I think the last thing I wanted to talk about was that it's really important when we do projects like this that we have an opportunity to say, how are we doing? The transition from the 1-800-273-TALK to 988 is one part. But we also want to make sure that the call metrics, that people are receiving a call, have their call answered, the time, and what happens to the individual. Are they connected to services? So we've built in some follow-up for both the call center and our mobile crisis response, so we can continue to look at a number of different metrics and data points and pivot and continue to problem solve and make Nebraska have one of the best systems possible. We have also collaborated, Dave Sankey, the director of 911 for the Public Service Commission, is not able to join us today, but has been an awesome partner on looking at protocols and ways to share information, handoff of calls, and so forth. And so we'll continue to work through those transitions so that people get the level of care that they really need. So I have a lot more to say, but Kyle, you're just like, cut her off. Okay. But it's my pleasure right now to introduce Kyle Kenny, who's been a great partner at Boys Town at the call center.
Good morning, everyone. Thank you, Sherry. I appreciate the opportunity to visit with everybody. Governor, I do appreciate you referencing the system of care work that started in 2016. I want to say, without the partnerships and relationships that were formed through that work, this probably isn't as far along as it is. So I think a lot of that can be traced back to that point, because I think things really took a leap forward in Nebraskans working together to serve our own state. So I do appreciate that reference. I do also want to thank all of our partners that has currently been working on this, making it possible. Sherry did a really good job of naming them, but I'll name some of the ones that I thought to name. I appreciate the Division of Behavioral Health at DHHS. They've really been on ground level work since day one and making this all possible and working together to transition to the 988 system. I want to thank the University of the Nebraska Public Policy Center, the behavioral health authorities across the state, and all of the providers and stakeholders who have participated in all of the implementation planning teams and meetings over this last year. We've been very busy, and it's been a really good opportunity to work together again to move things forward. It's absolutely been a huge pleasure to work with everybody across the state, because we are benefiting our state. I do want to start talking this morning really with that reminder that where 988 as a crisis line is coming from. The 988 crisis line is taking the existing National Suicide Prevention Lifeline, 1-800-273-TALK, and it's transitioning it to that 3-digit, easy-to-remember phone number, 988. As really that first step in creating a crisis continuum for suicide prevention, as well as mental and behavioral health crisis, really mirroring the 911 model. Like it's been mentioned, Boys Town will be providing the crisis line response. The Boys Town National Hotline has provided crisis hotline services since 1989 and has been the Nebraska provider for the Suicide Prevention Lifeline since its implementation in 2005. Boys Town was also the original National Suicide Prevention Lifeline Backup Center, providing backup coverage for other states. So this Saturday, July 16th, is the launch of 988. It is the initial step because 988 is more than the crisis line. 911 took 40 years for nationwide implementation. We'd sure like for 988 not to take that long. As far as the 988 crisis line, we will continue answering calls 24/7 at transition. Callers in crisis who reach the 988 in Nebraska will reach trained crisis counselors who will work with the caller to do a number of things, starting with de-escalation. We're going to be using trained de-escalation techniques to walk back from that crisis. We're going to assess safety, really looking at lethality risk for suicidality. And then we're going to safety plan with our callers. We're going to be using best practices informed by our accreditation with the American Association of Suicidology. Once we've reached that point, we assume things are safe, we're going to do some resource navigation. We utilize a list of resources of 1,600 different Nebraska agencies and services to connect our callers to services moving forward. And finally, we're going to schedule a follow-up with the caller to review the safety plans and do the resource navigation, because we want to make sure that not only they're connecting, but they're continuing to be safe. I do want to provide a little bit of utilization and service provision data to give the scope of Nebraska call volume and service need. In 2021, Boys Town handled 8,777 lifeline calls from Nebraskans. Of those, we were able to de-escalate 97.1% of Nebraska callers to the Suicide Prevention Lifeline without requiring external emergency intervention. Additionally, we provided crisis support to 12,008 callers to the Nebraska Family Helpline. In June of this year, we've received 1,073 calls to Lifeline from fellow Nebraskans with a 93% answer rate. Through the first 6 months of 2022, call volume to Lifeline Local, so Nebraska, is up 16% over the same time period in 2021. So there is, what is 988 going to do to volume? It's already doing something. It'd be interesting to see where it goes forward. Breaking down 2022, it started off in January with 935 calls, 910 in February, 982 in March, some pre-release about 988, and we shot over 1,000 to 1,008. and then 1,068 and 1,073 calls. So it is continually increasing even over the 6 months of this year. So it is, it's been a wild ride. Looking forward to everything that comes next, and I do appreciate our partners. I do want to turn it back over to Governor Ricketts at this time.
Great, thank you very much, Kyle. And now we are going to go ahead and run the video about 988. So let's go ahead and show that video.
If you or someone you know is experiencing thoughts of suicide or having a mental health crisis, call 988 for free, confidential support. The Suicide Prevention Lifeline has a new number. When you call, text, or chat 988, you will be connected to a trained crisis counselor who will listen to your concerns. There is hope, and the Lifeline works. Just call, text, or chat 988.
Great, thank you very much. And thank you all again for being here for our announcement with regard to 988. Again, it's going to be rolling out starting July 16th, and it will be transitioning from the 800-273-TALK to the 988, though you still will be able to call 800-273-TALK. If that's what you've got memorized and you want to call that, you can still call that, but 988 should be easier for most people to remember. So we're excited to get that roll out. And Kyle, thank you very much for all the help that Boys Town has provided to the state over the years, and continuing to work with you going forward. And Sherry, thanks for all your work in the Division of Behavioral Health. So with that, we'll go ahead and open up questions on this topic, and then if we have time, we'll move on to other topics after we exhaust questions on this one. Questions? Yes, Martha.
How is this being paid for, especially going forward?
So the question was, how is this being paid for? And Sherry, I'm going to let you tackle this one.
Sure. So the call center right now, we, in the Division of Behavioral Health, we are funding the Nebraska Family Helpline, and we are funding the Suicide Prevention Lifeline. So there's right now a total of about $4.7 million for the 988 and the Family Helpline. And the SAMHSA also has cooperative agreement grants. So the call center will, in Nebraska, will be getting about $640,000 to help support the call center.
Thank you, Sherry. Paul, you got a question?
How will that 800 number be valid? Is that just going to continue into infinity beyond?
We've been assured at least a year. So Vibrant Behavioral Health is the national backbone agency, really responsible for that telecom piece. And so as they transition all of the different infrastructure to 988, they are keeping that live for at least a year. I think it'll be in place as long as it needs to be, is really what the communication has been. So a while.
So again, your point is people keep calling it, they'll keep it open.
Yeah,
All
it'll
right.
keep going in a route to the same.
Right.
place.
Okay.
And is there some doubt that this won't be adopted nationwide? I mean, you said it took 40 years for 911 to get rolled out.
Well, I think the question was, is there any doubt about this not being rolled out nationwide? Actually, I don't think there's any doubt that it'll be rolled out nationwide, but I do think that it's going to take time for the 988 number to be adopted. So that's why we've got the transition plan where 800-273-TALK will be around for at least a year, if not longer, so that we can make sure that people don't fall through the cracks.
Governor, the Pew Research Center says that 53% of suicides in the U.S. involve a gun. Is there any need for a change in the laws or regulations concerning guns to decrease this problem?
So Fred's asking the question with regard to suicide. The Pew Foundation says that 53% of suicides in this nation are gun-related, and so he's asking, is there any need to change the gun laws? And I would get back to just that I think the thing is being proactive with regard to the causes of why people suicide, and that's how the 988 number is going to roll into that to get people the resources. So I don't see any need to change gun laws. We need to focus on behavioral health and mental health.
What are the causes and demographics that you see people?
So you guys want to get into the cause and demographics, Kyle?
For callers or for those who complete the act of suicide? I'll speak to callers.
Why don't you just step up and do the
Yeah.
calling thing?
So reason people are calling in, the Lifeline fields a number of mental health type related calls. The vast majority is suicide related, where it's current ideation, they're in current thoughts. where they're experiencing that. I think a large percentage of callers would be diagnosed as severe and persistently mentally ill. And I don't have the numbers in front of me on that because I haven't been doing it long enough to know, but I'm sure there is plenty of research out there that can give you a specific data point there. But so between the severe and persistent mental illness and that current thought of suicide are really the two largest driving factors for callers to Lifeline. As it relates to overall suicide completion and those percentages, the social science has very much evolved over the last decade. And there's a number of different things you can read and lots of different things that are attributed to the cause. I think if you want to dive in, look at social media, look at opioid addiction, look at just all the different social upheaval, and you start to see, again, there's lots of social science that can, and one's gonna say this, another's gonna say that. In the end, people are very uncomfortable, and they're finding ways out, unfortunately. And so with that increased mental illness comes increased suicide. So I think.
So Kyle, do you have any demographics on men versus women, age differentials or anything like that?
So yeah, I didn't bring the specific demographics. Really the standard kind of men attempt less and complete at a much higher rate. Here's the one that bothers me the most, is the 10 to 14-year-old suicide rate is skyrocketing, and any given year it's the number one or the number two reason that a 10 to 14-year-old dies in this country, and that bothers me. I probably shouldn't get personal up here, but that bothers me. And so when you want to start talking about suicide and you look at those younger populations and their increasing rates of suicide, that's where we really need to start maybe coming up with some answers as far as why is this occurring, as well as what do we want to do about it. I think we're all this is put together like, what are we going to do about it? But let's keep asking the questions, what are we going to do so we don't have to do something about it? So that'd be my personal opinion, if you'd like it.
Sure, do you have anything you want to add?
So I would just add, and that's probably an opportunity for us to put the age demographic, and for individuals that die by suicide, we can do it by age demographics, and talk about the leading cause of death across the age continuum. Certainly we have seen an increase in younger people, but we also have an opportunity with men that are middle-aged. But we will be happy to, Julie, I'm just going to say, let's make sure we have information out there. And I would say that there are individuals that are experiencing a variety of life stressors, including socioeconomic and a variety of stressors, where not all individuals that have thoughts of suicide are necessarily diagnosed as, with serious mental illness. And so there is a view that there is a short-term, very challenging situation, and the opportunity for them to call and get help for that impulse, for that thought that they're having, and that early intervention is really key to saving their lives. But we'll make sure that we get, it's a good question, the demographics and the rates out there for you all to see.
Thank you, Sherry. Yeah, Paul.
Can you get a little more information about these response teams?
Can you talk about the mobile crisis response team, Sherry? You want to talk about that?
How often are they called out to give a call to your company?
So we have about 13 providers for mobile crisis response across the state. So through our regional behavioral health authorities, there are at least 2 providers in all of our regions, and sometimes 3. They also help provide that 24/7 crisis line, which we are also, I want to make a note, we are also continuing for a period of time, because if people in that local area are used to calling that number and calling their local mobile crisis response, we want to continue that access. But they receive a call, and Kyle's team will now be able to dispatch those mobile crisis response teams. And there is training that they also go through, screening and assessing for suicidality. There is an opportunity for them to connect by telehealth if there's a distance to go, maybe before they would go to their home, to do an intervention, de-escalate, make referrals. If it's determined that they may need to be evaluated at the hospital, that they can see that that gets done as well.
Do you know how often they get called out? Like how often do you have to dispatch a team?
I don't have our total number. Brad, do you? I would say daily. Well, I was going to say, all of our teams get called daily. If you want to know how many actual units or instances, I can get that for you, Paul. We'll look out.
And so let me understand,
Okay.
somebody calls the helpline, they talk to somebody from Voice Town, and you say now they're able to dispatch these crisis teams, or were they in the past?
For not all of the.
Repeat the question.
Oh, sorry. Paul is asking if I said that now if someone calls the 988 center, that now people will be able to access Mobile Crisis Center, and wondering if that was the case before. That was the case before for some of our teams, but not all of the teams. And so we wanted to ensure that those connections were made for all of our teams.
Okay, any other questions on this topic? All right, seeing none, I'll again thank our guest. Sherry, thank you so much, as always, for all the great work you do in the Division of Behavioral Health to be able to help Nebraskans stay healthy. And Kyle, thank you very much for all the great service Boys Town has given the state over all the years. We appreciate it.
Very much.
Thanks. All right, so questions on other topics?
Under on the possibility of a special session on abortion, you said that you want to protect the in vitro fertilization. It sounds like you're not up for exceptions for rape or incest. Are there other changes that you think should be considered to the trigger bill that was introduced last session that would help you get to the 33 votes that you need?
So with regard to, Fred's asking about, hey, I mentioned in a previous press conference that, you know, any future bill needs to address some of the concerns that were brought up in the last session with regard to, say, for example, in vitro fertilization. And are there other topics like that? And I'd say at this point, I'm still having conversations with the speaker, so I don't have anything new to announce with regard to that, so I'd say just stay tuned.
And can you say where you stand with?
I would say just stay tuned, Fred. When we're ready to start making announcements, we'll make announcements. Don't worry, you'll be the first to know. But,
Admit you're short of 33.
excuse me?
Don't you have to admit you're short of 33?
So Paul's asking with regard to, do we have 33 votes? Obviously, in the session that we had previously, we had 31 votes, and I'm continuing to have, that was a different bill though, right? That was a complete ban. And so I'm continuing to have conversations with the speaker, and stay tuned.
Does the construction that's going on in the chamber affect the timing?
And Fred's asking, does the construction that's going on in the chamber impact the timing? The answer is no.
So you could do it across the hall?
Again, if we were going to move forward, if we were going to move forward in a special session, I'm sure we'd find accommodations to be able to make sure that would happen. Yeah.
And on the new GOP leadership saying that they're gonna have a bottom-up structure now, and then he criticizes, I think correctly, you, that the party was controlled from the top down.
So Paul's question is, with regard to the new leadership at the Nebraska Republican Party, they're saying they're going to do a more bottoms-up, county-based organization versus what they were saying was more of a top-down based organization. Is that fair, Paul?
Yeah, I think
Yeah.
it's sort of aimed at that criticism.
So I would say that the Nebraska Republican Party was very successful in electing Republicans. But there can always be more than one right way to get that done. And so I look forward to seeing what the plans with regard to the new leadership is, with regard to how they intend to elect Republicans. You know, that's, as the Republicans, that's our goal, is to elect more Republicans. And there can be more than one way to be able to get that done. And so I look forward to seeing what their plans are.
Do you plan to continue to contribute to the Nebraska?
So the question was, do I plan to contribute to the Nebraska Republican Party? I have already been very generous to the Nebraska Republican Party, Paul, well, again, I've been very generous this year with the Nebraska Republican Party, Paul, already.
So will you continue that generosity?
I have already been very generous with the Nebraska Republican Party this year, Fred.
All right, one more question.
All right, seeing no more questions, thank you all very much. Again, we want to thank Sherry and Kyle for announcing the 988, and please help spread the word about it. Let people know they can dial 988 to get access to those resources to be able to help with suicide prevention, whether you're the person who has suicide ideation or whether you're a family member or friend that is seeking help for a loved one, please call 988. Thanks very much, everybody. Have a great rest of your day. Starting July 16th, by the way. July 16th, 988.